Hello, my name is Maria Isabel Echavarria. I am an MPH student at the University of Washington, and I'm working in this research project with the Fred Hutchinson Cancer Research Center. The research that I'm going to present today is a first approach to try to understand the uptake of the Breast Health Global Initiative guidelines in low and middle resource countries. We know that international guidelines are important tools for guiding decisions, but we also know that the uptake and implementation of these guidelines is still a challenge, specifically for low and middle income countries. This is the outline that I will follow during this presentation. Breast cancer in women is a major public health problem and represents the most common cancer killer of women worldwide. Currently, it is estimated a global incidence of 1.38 million of new cases per year, and until recently, it was considered a disease of the developed world. But the reality is that breast cancer affects countries at all economic levels. As you can see in the graph with the purple line, today, more women in less developed regions are affected and dying for breast cancer. Acknowledging this, an organization in Seattle, the Breast Health Global Initiative, strives to develop and implement evidence-based and economically feasible guidelines for breast cancer for low and middle income countries. They have held different summits inviting experts from all over the world to define these guidelines. 3 series of guidelines have been published since 2003 with different approaches. The majority of clinical guidelines assumes that all resources are available, and this is a problem specifically for low and middle income countries. One of the most important characteristics of the Breast Health Global Initiative guidelines is that they are resource sensitive. It means that the authors provide recommendations, different recommendations, depending on the level of resources available. They have defined 4 different levels: basic, limit, enhanced, and maximal level of resources. Another important characteristic of these guidelines is that they are comprehensive, since they address topics such as early detection, diagnosis, and treatment by stage. To provide you an example, if we look at the detection methods, the authors suggest in the basic level of resources that countries should run clinical history and clinical breast examination. But if more resources are available, for example, in the enhanced level, they suggest that we should do mammographic screening every 2 years. Until now, there has not been an overall assessment of the use of these guidelines. With this research, we are conducting a systematic review and a citation analysis in order to understand how these guidelines have been used in the global health literature as a proxy for potential impact. We will answer the following questions: to what extent the guidelines have been referenced, what guidelines topics are the most commonly referenced, for which geographical regions, and for what purposes. 15 guidelines are the core documents of this research. We conducted an extensive review of the literature in 4 online databases, trying to look for documents that have referenced the guidelines. We found 2,090 documents, but then when we applied our inclusion and exclusion criteria, we ended up selecting 776 records for our analysis. From these records, we extract key information, such as author, journal, year, but also we extracted more detailed information, such as purpose of the study, abstract, and also the specific citation of the guidelines. Then, with this information, we conducted our analysis. We conducted quantitative analysis, trying to identify frequencies and distribution of these documents by topic, by region, and by internal and external references. And we also conducted qualitative analysis. The qualitative analysis was to try to answer our question about how the documents are referencing the guidelines. We found 3 different categories. Some documents are referencing the guidelines as a general reference. Other documents are referencing the guidelines as an analytic tool. And we also found some documents that are using or referencing the guidelines as a framework for implementation. Here are our findings. We found, in relation with the extent of citations, that the majority of the documents are external publications. And with this, we mean that are documents from authors outside of the Breast Health Global Initiative. We also found that there is a clear trend toward increasing the number of external publications. This is important because this speaks about dissemination. In relation with the topics that are more commonly referenced, we found that the second series of guidelines, the guidelines from 2006, are the most referenced. Within these guidelines, the authors introduced the concept of resource stratification. And this concept seems to be very important for low and middle income countries. In addition, when we break down for specific topics, we found that the major attention has been placed in the guidelines referencing early detection, and also the overview, which are the guidelines that are presenting the general management of the disease. But less attention has been placed in diagnosis, treatment, and healthcare system. In relation with the regional analysis, we found that the majority of the documents, almost 60% of the documents, are focused on low and middle income countries. Only 9.4% of these documents are actually concentrated in developed regions. The most common regions are Sub-Saharan Africa and Latin America. And when we look at the details of the countries, we found that the majority of the countries that are using the guidelines are middle resource countries. To answer our question about how the guidelines have been used, we found that 68% of the documents included in our research are using the guidelines as an analytic tool. This means that they are using the guidelines to support an idea related with the management of the disease, but they are not yet implementing the guidelines. Sometimes that even suggest a course of action, but not implementing. Only few documents, 6% of the documents, are actually using the guidelines as a framework for an implementation process. However, when we look at the time analysis, we found that there is an important increasing of the number of documents referencing the guidelines as an analytic tool, and it could be a good signal for future implementation. In summary, we found our findings suggest that there has been an important level of attention of the Breast Health Global Initiative guidelines in low and middle resource countries. This is important because this speaks about dissemination and also about utility of the guidelines. The concept of resource stratification seems to be very important for low and middle income countries, and this is an opportunity because this idea of resource stratification could help countries not only with resource allocation, but also with implementation. Major attention has been placed on early detection, and this is an opportunity for low and middle income countries since there has been extensive support in the literature that early detection is important to reduce not only mortality and morbidity, but also to reduce costs and reduce complexity of the management of the disease. Finally, although there has been a lot of attention of these guidelines, implementation still remains a challenge for most low and middle resource countries. This study has some limitations. It relies on published studies meeting our inclusion criteria. We are using citation analysis as a proxy for potential impact, but we are not actually measuring impact. And since we use different ways of analysis, there might be possible document overlap. In the future, we need to develop more effective implementation strategies to try to narrow the no-do gap. While it is important that low and middle income countries are investing in early detection, it is also fundamental to capitalize in other areas such as diagnosis, treatment, and healthcare system. Finally, it will be important to conduct similar studies in the future, but over a longer period of time. I want to acknowledge my committee, Betty Thompson and Benjamin Anderson, the Fred Hodgkinson Cancer Research Center and the Breast Health Global Initiative, the Department of Global Health at the University of Washington, my professors and staff, my classmates and friends, and my family. Thank you.